Hello, my name is Diego Fiore de Carvalho, and my work SIPRAD Segmentation of Medical Images, Silhouettes at Radiotherapy Planning. I'm in charge of I-medsys company, the project SIPRAD. I'm Brazilian, and I would like to appreciate the sponsor for this project, São Paulo Research Foundation, Bebedouro University, and Hermínio Meto Foundation. This work is in collaboration to Clinical Hospital at São Paulo, University of São Paulo in Ribeirão Preto, and the University of São Paulo. This presentation for the IEEE major section in Asia, Vaniyambandi, Tamil Nadu, India. Well, now the brief of my presentation. The first step is talk about the clinical and hospital environment. It's the main important to understand this work. The second topic is a gap, okay, the whole of this project. And the third, the goals of this work. For the SIPRAD project, and next the SIPRAD body technique, an important major process technique to radiotherapy. And next, after, I talk about the results and analysis of this work, the technique, and the application in patient surveys in Brazil. Finally, I talk to conclusions and future works of this work. What's the environment, the clinical and hospital environment I talk? I talk about the cancer disease. Cancer disease is a lethal disease in all the world, and the several technologies important to use in the cancer treatment. Top of technology in diagnosis, top of technology in prevents, top of technologies in treatment. In the especially treatment of lung cancer disease, use expensive radiotherapy. Radiotherapy steps is radiotherapy important to radiation to access human body, and important workflow to radiotherapy like this. The first step to radiotherapy in the 5 steps is a planing tomography. Planing tomography or computed tomography is a tomography if slicer the human body to planning the surgery or the radiotherapy section. After the tomograph acquisition is they send these images to DICOM RT file for the planning stage. It's a workstation, a high workstation, a robust workstation to process this imaging process to the treatment, the process treatment. In the planning stage is the main section, the main step of this environment technique. The next is the radiotherapy application, because the planning stage of the focus in the area, tumor areas, and the radiotherapy applications, the sections to patient go ahead to the treatment. Next, the position revision is a collegiate of doctors to talk this evaluation this treatment, and finally the follow-up to doctors and the another treatments inside the cancer disease. Well, hospital and clinical environment use the 3 softwares, the main several 3 softwares. The first software is a hospital information system. Hospital information system is a administration management system, is the first system of the hospital. The second system is important to this process, to workflow, is a RIS. RIS is a radiologic information system, and the radiologic information system is a intermediate system at the radiotherapy and the hospital information. The next step is acquisition CT images, with the talk before, and the planning radiotherapy system receives the images of the PACS. PACS is a picture archiving communication system. It's an important software, the third software of the situation, to storage in the especially databases the DICOM RT images. And these images is stored remote or in locale of the hospital or the clinic. And the paper talk about this section, records of treatment, DRR or SCOUT, RT plan, transfers to medical prescription, and the planning stage of the radiotherapy section is the whole of the work. Well, the problems related to my work. The first problem is related to drawing. Because the doctors, medical and physics need the drawing slice by slice of the tomography, computed tomography. In this example, is possible to see the drawing, the vector drawing of the lung in the human body axial CT. And the doctor drawing the first drawing and go ahead, the more drawing, go ahead, and finally. It's a slow process, it's not so good to workflow in the hospital and the clinical hospitals. Well, the axial CT, computed tomography, is related to this, and there's two types of vectors counter slices. The first type is the name TV. TV or tumor volume is a region to kill. I need to kill this region, I need to radiotherapy, kill for the radiation this region. And the another region is the OR, organ at risk. Organ at risk, I need to preserve in the patient. It's the two types of the regions of interest, or ROI, in the several papers of the world. The second problem related to this paper is related to clinical gaps. Clinical gaps is a hole in the slicer of the tomography, computed tomography. The human body acquisition is slice by slice, but the hardware machine is a problem to slice by slice. It's commonly to see the clinical gaps, the hole in the axial exam. It is a problem to us to image process. I need to create a technique to build this problem with the clinical gaps. Well, the goals of this project is an imaging process technique computationally feasible that is able to perform an automatic counter delineation in patient body silhouettes, the named SIPRAD body. Is an important image process technique for related to PCs process, personal computers, not workstations, with the several commercial products. The SIPRAD body techniques performing tomography slices under grayscale image, extended their use with a grid algorithm in the 3 dimensions in the image process. Okay, the solution for the first gap in this project is a creation the interface patched by Paes. The Lyria Paes is another software by company I-medsys, and upgrade this software to the named SIPRAD and SIPRAD projects. The Paes Picture Archive Communication System have a DICOM communication, a DICOM images RT for the full, and this type of design of interface is important to doctors drawing in the personal computers and drawing regions of interest. The solution for the second problem, the clinical gaps, is a OR segmentation, or organ at risk segmentation. Is an important interpolation to image section. In this problem, like this, like a lung, I need the technique to segmentation with points. In this case, P1 or P2 is 2 points to delineation this problem. P1, P2 generates the P3. P3 is a median point of 2 points. It's possible to see in B. In C, P1 and P2 generates two new points, P3 and P4. P3 and P4 generates by interpolation of 2 points. In another case, in D, it's possible to see the more points in this case. The 10 points generates by P1 and P2. The question related here is how many points I use to a good solution of my work, a good solution of automated or semi-automatic solution with these doctors using day by day in your clinics. The SIPRAD is a Brazilian project, SIPRAD, named SIPRAD, radiotherapy planning system, presents a proposal adapted to emerging countries' reality, emerging country realities like Brazil, like South Africa, like India, reality, that generally does not have the monetary country conditions to acquire some radiotherapy planning workstation, resulting in wait queues for new patients treated. It's important to talk about this because it's more expensive to emergency country this kind of software. And for example, one software delineation is the $100,000 for one license. Is a big problem to population like Brazil. The SIPRAD project is composed by a set of integrity and interoperability softwares that are able to execute all stages in radiotherapy planning on simple personal computers, PCs, in replace to the workstation. Now, the process, the work is focused to use the parallel computing to needs the small workstation, small PC, process the all of data important to big data like this. Well, now is appointment to the SIPRAD interface. It's a now interface of this project, January now, okay, the date January now. The interface design is like 4 points to view. In A, it's possible to see the axial CT, axial axis CT, axial in A, is a default tomography, computed tomography with dichol. In B, it's possible to see the coronal view of computed tomography. In C, it's possible to see the sagittal view, and in D, it's possible to see 3 dimensions view. In A is default to computer tomography, but B and C generate with interpolation because use the technique MPR. MPR is multiplanar reconstruction. Multiplanar reconstruction is the name of this technique. B and C generate and next the 3D dimension. In the doctor, manipulate the A, B, and C to draw in the regions interest for the tumor volumes and ORs, organs at risk. Well, the SIPRAD body technique is a SIPRAD body creates a regular polydrome with the Kenny Edge adapted algorithm without the use of pre-processed filters as contrast and brightness. In addition, compare the technique SIPRAD body with existing current solution is reached at contours similar to at least 85%. In comparison with variant, for example, or human body skills, human doctor skills, at least 85% is a contour reached current solution. It's a good results of this project. For this comparison is used 4 criteria: contour area, contour length, difference between the mass center and Jacquard index technique. SIPRAD body was tested in a set of oncologic exams provided the clinical hospital at the University of São Paulo. It's a survey of patients. In this case, use the patients in the different conditions, the ethnology, ages, tumor volumes, the kind of the treatment, the type of treatment, the type of disease, cancer disease. And I'll talk about the 100 patients in Brazil in the hospital of this Brazil. Use the DICOM protocol, DICOM RT protocol to patient survey in the tests of this technique. The results, is good results, is related to how many cuts is needed to the good solution. Now it's possible to see the 3 and the 9 interpolation, and 6 and the third 6, whatever. In the cuts, width is different to cuts. The width is the length of the cut is different to this comparison interpolation results. Now the main table is results, the important table is possible to see in the green area is a good interpolation. Jacquard index is near to 1, is good, and the green is a region 2, okay. But in yellow is a region not so good, not is the perfect counter, not is the perfect region of this region. In two lungs, for example, I need the 7 points to use the 85% for 85%. It's a good result for analysis. And the more than 7, 8 is not perfect, but easily the perfect solution. The conclusion, it's possible to see the yellow is a not so good solution, and all is the good solution. In the yellow, this type of image, you talk about the 85% of results in this case with this patient. So therefore, the conclusion, it's the SIPRAD body technique is feasible for more equal than 7 cuts because of this degree of similarity in both new radiotherapy, planning service, and existing service. For future works, I need to evaluate the testing more this automatic counter of any types of tumors, not the lung, not the pelvian, is another types of cancer disease, and the robust technique generate a greedy algorithm. Thank you for this presentation. Namaste.